Hello class, my name is Lucas Schutz and today we'll be talking about reducing the risk of STIs. What are STIs? STIs are an infection spread through intimate contact with another person's skin or bodily fluids. Each year, nearly 20 million people contract an STI. Engaging in sexual activity one time is all it takes to contract an STI. People with more sexual partners have greater chances of getting an STI, especially if no protection is used. How do STIs spread? Generally, they spread through some type of intimate sexual contact. Sexual intercourse is the most common type of how STIs spread. Can be any type of sexual intercourse, so oral to genitals, genital to genital, or oral to oral. Less likely sexual intercourse transmission types would be mouth to mouth or oral to oral. Pathogens that cause STIs live in and on reproductive organs, and that is how STIs spread. They can also live in the mouth, rectum, blood, and other bodily fluids. Now we will talk about some common types of STIs. The most common type of STI is chlamydia, and it is typically found in women. There are no symptoms typically, but with doctor screenings on a typical checkup, that is how it is typically found. Antibiotics can treat chlamydia. Chlamydia can intensify a pelvic inflammatory disease in females, which can cause infertility. Our next most common STI is gonorrhea. Men get a white, milky discharge and painful urination. Women do not experience many symptoms besides possibly low-grade fever. Antibiotics could help if it is found early, detected early, but it also could be untreatable if it's not found early and gets out of hand. The next type of STI we're going to talk about is syphilis. It is generated via direct contact with a syphilis sore on a partner's body during sexual intercourse. One injection of penicillin is the most common treatment if caught early enough. So again, if it is caught early on in the stages of it, then it can be treated. Now we'll talk about some more major types of STIs. Herpes. There are two types of herpes, HSV1 and HSV2. HSV2 is more likely found in women. Males are more likely to transmit the virus, so once they get it, they're more likely to pass it on to someone else. There are also racial disparities in herpes. A statistic in the book said that African Americans are 3 times more likely to get herpes than people in other countries. There is no cure for herpes. HIV and AIDS are transmissible through direct sexual contact or exchange of saliva, semen, vaginal fluid, blood, and other bodily fluids. HPV is many STIs all together, so it's a very large group that splits into other types of STIs. It's a family of 100 viruses, but 40 transmit sexually, so many different STIs, 40 of them total. 80% of sexual active Americans contract some type of HPV. There's an HPV vaccination, and earlier on that you find out that you have HPV, the more treatable it is. The best ways to prevent STIs. Abstaining from any type of sexual intercourse is the best way, so that way you'll be having no sexual contact with any partner, so you have no chance of getting an STI. Getting vaccinated, so talking to a doctor to find out if you are healthy enough, if you should get the HPV and hepatitis B shots. That way you have a protection from those. Reduce the number of sexual partners you have, so if you are sexually active, keep it to a minimal of amount of partners. Getting tested regularly, so telling your doctor that you think that you may have something going on after you had sexual intercourse, and if you didn't have safe sex, then you are more likely to have an STI. Using condoms during sexual intercourse. Uh, so finally, some other tips that I wanted to add in at the end. Again, it never hurts to speak to a doctor or a nurse or maybe a counselor at school before having sexual intercourse, or your parents if you have questions about it. Being sober during sexual intercourse can prevent any mishaps, so unplanned pregnancies, unprotected sex, things like that. Talking to your partner to find out what is right for both sides of the relationship. So finding out what each one of you wants before having sexual intercourse or one person forcing it on the other is always a good thing to do.